Good evening, wherever you are. This is Talia Stone from ConferenceHype. Our segment will focus on exploring potential value of neutrophil extracellular traps in major depressive disorder. From the 2026 edition of Frontiers in Immunology. Background: neutrophil extracellular traps can induce cellular and tissue damage through inflammatory responses. Methods: 2 independent clinical cohorts and a chronic unpredictable mild stress mouse model were used. Results: independently validated across 2 cohorts. Plasma levels of net markers were significantly higher in MDD patients than in healthy participants. Discussion: plasma nets may be associated with the occurrence and progression of MDD, potentially via inflammatory mechanisms. From the 2026 edition of Frontiers in Immunology. Inflammation is an essential host defense mechanism, but, when excessive or chronic, can cause severe tissue damage and organ dysfunction. Exosomes, a key subtype of extracellular vesicles, have emerged as critical mediators of intercellular communication by transferring bioactive cargo and modulating inflammatory signaling. This review summarizes the roles of exosomes in inflammation-associated tissue injury, focusing on their regulation of classical inflammatory pathways and programmed cell death. We further discuss the dual functions of exosomes as pathogenic mediators and therapeutic agents, highlighting their diagnostic and therapeutic potential. From the 2026 edition of Frontiers in Immunology. Background: the pathogenesis of ulcerative colitis remains incompletely understood, and effective therapeutic targets are still lacking in clinical practice. Methods: immunofluorescence was used to detect the expression and localization of ZBP1 in colorectal tissues from UC patients and DSS-induced colitis mice. Results: ZBP1 was significantly upregulated in colorectal macrophages from UC patients. Discussion: ZBP1 aggravates intestinal inflammation and barrier damage by driving macrophage pyrotosis and pro-inflammatory polarization, representing a novel key molecule regulating abnormal macrophage activation in UC. From the 2026 edition of Frontiers in Immunology. Background: aging is associated with numerous physiological changes that contribute to immunosenescence and inflammaging, resulting in a decline in immune defense and an increased susceptibility to infections. Methods: we reviewed and discussed available human, animal, and in vitro studies examining the relationship between water-soluble vitamin status and immune parameters in older adults. Results: these deficiencies may have relevant but often under-recognized consequences for immune function in the elderly. Discussion: aging and insufficient plasma levels of water-soluble vitamins are both associated with immune decline and chronic inflammation. This concludes ConferenceHype's coverage of the January 2026 issue of Frontiers in Immunology. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is ConferenceHype. Stay with us, coverage continues.
From the 2026 edition of Frontiers in Immunology. Background: introduction. Sjogren's disease is a chronic autoimmune disorder characterized by dry mouth and dry eyes due to inflammation in exocrine glands, particularly the salivary and lacrimal glands. Methods: in this study, we aimed to identify single nucleotide polymorphisms associated with SJD by categorizing patients based on 4 diagnostic markers: antero/SSA and anti-LA-SSB antibodies, IgG levels, and lymphocyte foci, using a genotype-phenotype dataset which included 594 SJD patients, 1,264 sick asymptomatic individuals without SJD diagnosis, and 41 healthy individuals. Results: although genome-wide association studies have identified several genetic variants associated with SJD, their roles in SJD pathogenesis remain unclear. Discussion: we identified SNPs associated with each subtype of SJD, organized by two factors of diagnostic markers, X and Y, with an adjusted p-value less than 5x10^8. From the 2026 edition of Frontiers in Immunology. Nasal and upper airway allergic disorders, such as allergic rhinitis and allergy-associated sinus inflammation, constitute a major global health problem because of their high prevalence and significant negative impact on quality of life. There are indications that lysosomes to a large extent participate in the process of airway inflammation by both starting and intensifying the immunological signaling via certain ionic channels. The resulting release of pro-inflammatory cytokines occurs through calcium signaling mediated by lysosome activity, and this is particularly the case when the NLRP3 inflammasome is activated. Hence, mucosal inflammation and increased airway sensitivity develop. Recent studies have identified the lysosomal ion channels, such as the 2-pore channels and transient receptor potential mucolipin, as the main regulators of these processes. From the 2026 edition of Frontiers in Immunology. Background, introduction: neutrophils, the most abundant leukocyte population, play a central role in host defense against group B streptococcus, an encapsulated bacterium that frequently causes severe infections in humans, including sepsis and meningitis. Methods: neutrophils were isolated from the peripheral blood of healthy donors and stimulated with live and killed GBS or their nucleic acids, in the presence of specific inhibitors of immune recognition receptors. Results: we initially found that neutrophils produce similar levels of several pro-inflammatory cytokines when stimulated with either live or heat-killed GBS. Discussion: these findings reveal a tripartite sensing mechanism involving TLR8, FPR1, and FPR2, which together amplify neutrophil responses to live GBS. From the 2026 edition of Frontiers in Immunology. Background: pernicious anemia is a severe clinical consequence of autoimmune gastritis. Methods: to address the intrinsic diagnostic uncertainty of PA arising from heterogeneous, graded, and often discordant clinical, histological, immunological, and biochemical information. We developed ISBAD, an explainable AI-based probabilistic framework to integrate this information, producing a probability estimate of pernicious anemia that reflects clinical reasoning rather than rigid diagnostic thresholds. Results: ISBAD was examined using a series of published diagnostically challenging cases reflecting real-world complexity. Discussion: ISBAD illustrates how explainable artificial intelligence can formalize expert reasoning in autoimmune-related pernicious anemia. This concludes ConferenceHype's coverage of the January 2026 issue of Frontiers in Immunology. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 edition of Frontiers in Immunology. Background: to review the evolving shift in periimplantitis research from traditional mechanical debridement toward host modulatory and immunopharmacological concepts, focusing on molecular pathogenesis, candidate therapeutic targets, and advanced drug delivery systems requiring further validation. Methods: a comprehensive literature review was conducted to synthesize current evidence on the osteoimmunology of periimplantitis, including findings from single-cell RNA sequencing, studies on host modulation therapies, and developments in nanotechnology-based delivery platforms. Results: periimplantitis is increasingly recognized as an immunologically complex condition, with descriptive single-cell studies suggesting cell interaction patterns, such as the CXCL13 plus fibroblast CXCR2 plus neutrophil axis. Discussion: emerging immunopharmacological strategies, together with biomarker diagnostics and artificial intelligence, may help move periimplantitis management toward more proactive and personalized care, provided that their mechanistic relevance and clinical utility are validated in rigorous studies. From the 2026 edition of Frontiers in Immunology. Targeted B-cell depletion via the anti-CD20 monoclonal antibody rituximab fundamentally altered the therapeutic algorithm for rheumatoid arthritis. Despite its clinical entrenchment, approximately 40% of patients exhibit primary or secondary nonresponse, exposing critical limitations in conventional depletion strategies. This review critically deconstructs the mechanisms dictating therapeutic resistance and reevaluates B-cell pathobiology through high-resolution transcriptomic and clinical cohort data. We challenge the monolithic perception of B-cell pathogenicity by detailing the emergence of protective, tolerogenic anti-citrullinated protein antibody clones and regulatory B-cell networks that actively suppress Th17 proliferation and neutrophil extracellular trap formation. Mechanistic failure of rituximab is subsequently mapped to 3 biological evasions: the survival of CD20-negative plasmablasts within fortified synovial niches, the temporal spatial persistence of highly mutated B-cell receptor clonotypes, and the inadvertent eradication of IL-10/granzyme B-producing bregs, precipitating inflammatory rebound. From the 2026 edition of Frontiers in Immunology. The skin is the largest sensory organ in the human body. It has a neural structure that's very complex and diverse. A neural network spreads through the epidermis, dermis, and subcutaneous tissues. This network generates an exceedingly complex structure. It shows the deep functional links between the cutaneous system and the nervous system. This review systematically delineates the distribution patterns of cutaneous sensory nerves, elaborates on their distinct functional properties, and explores in depth the bidirectional regulatory crosstalk between epidermal cells and the sensory nervous system. Direct communication between these cells and nerves is not the only focus. The review expands on the potential mechanisms underlying these interactions, including chemical signal transmission and the regulation of immune responses. From the 2026 edition of Frontiers in Immunology. Breast cancer remains one of the most prevalent malignancies and a leading cause of cancer-related death in women worldwide. Increasing evidence indicates that regulatory T cells, a specialized subset of CD4 plus T cells, play a central role in breast cancer initiation, progression, and therapeutic response by shaping an immunosuppressive tumor microenvironment. TREGs originate from both thymic and peripheral differentiation pathways and are characterized by the expression of FOXP3, CD25, CTLA4, PD1, and other immune regulatory molecules. In breast cancer, TREGs accumulate within tumor tissues and peripheral blood through chemokine-mediated recruitment, local expansion, and phenotypic conversion, where they suppress anti-tumor immunity via IL-2 deprivation, inhibitory cytokine secretion, cytolytic activity, metabolic disruption, and checkpoint signaling. Their enrichment is closely associated with tumor immune escape, invasion, metastasis, and poor prognosis. This concludes ConferenceHype's coverage of the January 2026 issue of Frontiers in Immunology. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is ConferenceHype. Stay with us, coverage continues.
This concludes Conference Hype's coverage of the January 2026 issue of Frontiers in Immunology. Did we miss an article, or which finding deserves a deeper follow-up? Tag us on X and join the conversation. If this review helped you keep up, please like the video and subscribe so you do not miss the next broadcast.
This is Conference Hype. Stay with us, coverage continues.